What is a coordinated care plan? A coordinated care plan is like a personal roadmap for health. It can help a person and the people who care about them to know what to do when help is needed. The plan is usually written out so that it can be kept, updated, and shared with people who need to know about it. It is owned and controlled by the person themselves. It could be written on paper or in a computer. HealthLinks offers a document that makes it easy to write, read, and update the coordinated care plan. Who should have a coordinated care plan? Really, all of us should have a coordinated care plan. Everyone. That way, if we do need care at some point, people who know us and care about us will have a good idea how best to help. But a coordinated care plan is especially important for people who have persistent health problems or have several health problems and possibly different providers involved in their care. Every person is completely unique, with a particular set of circumstances, strengths, and challenges. And so no one care plan could ever work for all people. Each person needs their own unique care plan. Why have a coordinated care plan? When a person has several different care providers involved in their health care, it can be confusing for that person, but also for those providing care. Managing several different health conditions can be difficult too. With a coordinated care plan, a person can be sure their families and care providers know what matters most to them, what their life's priorities are, who is involved in helping them with this, and what medical and social details need to be taken into account. It helps everyone involved in care to be on the same page. What does it take to make a coordinated care plan? The person in the driver's seat is the person receiving care. They need to work along with their care providers to determine who should be involved in making the care plan, what will be included, and who will have access to the plan after it is finished. In most instances, someone other than the person needs to be the care coordinator. Ideally, this is a service provider that has an existing, trusted relationship with the individual receiving care. It could be a social worker, nurse, occupational therapist, doctor, or other types of service providers who are in the circle of care. A key to success is that the care coordinator be someone who knows the individual on a personal level. They will facilitate discussion between the person and members of the circle of care. They are responsible for helping the person to identify their health goals and getting a commitment from services and providers to help meet those goals. They can also work with the individual to update the care plan when necessary. How does the care plan work after it's complete? Once a person has their own coordinated care plan, it should be kept in as many different places as possible. On the fridge in their home, on their computer, with their family doctor and specialists, at the hospital, and even with a trusted family member or friend. Most importantly, the person should update the care plan regularly or ask their care coordinator to help with this. At times, it may require consulting again with other providers in the circle of care. And finally, a person will get the most out of their care plan if they have it with them whenever they are going for a health-related visit. Showing their care plan to their care provider will make things go just a little easier.